Hi, I'm Paul Dietze from the National Drug Research Institute and the Burnet Institute.
And hi, I'm Bernie Ward from Monash Rural Health.
And we're here to talk about the MIXMAX Cohort study that we've been lucky enough to get some NHMRC funding for, that will be running from 2023 to 2028.
In Australia, we take a harm minimisation approach to substance use. That is, we focus on reducing the demand, supply and harm reduction associated with substance use.
And what MIXMAX is designed to do is to try and access or develop an evidence base that supports new types of interventions. We know that smoking methamphetamine and injecting drug use drive most of the harms to do with drugs in the community in Australia, and MIXMAX focuses on those two groups. It really builds on two studies that we've had running for a long time now. So SuperMix, which is a cohort of people who inject drugs that's been running in Melbourne since 2008, and VMAX, which I'll let Bernie talk about in a minute. But SuperMix focuses on people who inject drugs. It looks at how basically their drug use evolves over time and the sorts of things that can help people shift out of drug use, as well as reduce other types of harms. And the main thing that we do is we do annual face-to-face interviews with people and take blood from them to look at things like hepatitis C and HIV. And those interviews take about an hour or thereabouts, and we basically do them in the field. So we have mobile vans that we can go out to those locations where they might be, and we follow them up every year. And what we've been able to show is things like how frequently they go to hospital and so on, how they use treatment services, how they get onto opioid agonist pharmacotherapy, for example. And it's been really important in terms of developing new policies and practices around injecting drug use.
The VMAX study has extended the work that's been done in Melbourne and has been a great opportunity for rural communities to participate in research with people who use substances. Primarily it's focused on people who smoke methamphetamine, because we now know that's the most common route of administration of this drug. To date, we've had a number of rural sites participate, but we're still gathering evidence to try and identify what works where. And to do that, we need to extend again the number of rural sites that are involved.
And the opportunity that comes to drive this new work is through the MIXMAX study. And really it combines those two cohorts that we were talking about, but also extends them. So we will recruit people in rural locations who inject drugs this time, and we'll also be extending our reach with our cohort of methamphetamine smokers. So we want to recruit people into the study from rural locations, and we also want help with being able to locate people over time. We'll be working with some services to set up locations where we do some of these interviews, and in kind of a really important sort of new element to the study, we'll be collecting blood samples and doing other sorts of tests like spirometry to really understand what's happening for people over time.
The Burnet Institute has been doing this work for many years now, and people's data is treated as highly confidential and separated out from contact data. So that means we have systems in place that ensure that we treat this data with the strictest protocols and ethics approvals.
And that minimises any risks that people might have in terms of their the risks of disclosure and those sorts of things. And ultimately what we will be doing with this information is doing further detailed analyses of the information that we collect. And then we'll take that results of those analyses and we'll use that in various ways to advocate for changes to policy and practice that will hopefully drive changes that will benefit not only the individuals involved in the studies, but their peers, but also the wider community. And that includes all elements of drug policy. So, hopefully reducing the rates of incarceration, reducing rates of arrest and so on, and helping all elements of sort of drug policy take things forward.
To date, there's been very little robust evidence collected from people who use substances and who live in rural areas. This is a great opportunity for us to do exactly that, to have interventions that are based on evidence from people who live outside metropolitan areas. So we are seeking your support to help us with this study, and if you'd like more information or would like us to come along and chat with you about it, please contact us.